We're working for Hawaii. You're watching Take Two.
This past fiscal year, the University of Hawaii hit a new extramural funding milestone, bringing in a record $515.9 million into the state for research, innovation, and training programs. $4.5 million of that went to the John A. Burns School of Medicine at UH Manoa for Ola Hawaii. Joining us to talk about it is retired Dean of the Thompson School of Social Work and Public Health at UH Manoa, Dr. Noreen Mokuau, who also serves as a multiple principal investigator for Ola Hawaii. Good morning, Doctor. Thanks for joining us.
Oh, mahalo nui for having me.
Yeah, this is very big. But first, can you talk about what Ola Hawaii is?
Ola Hawaii is a research center funded by the National Institute of Minority Health and Health Disparities. It is one of the largest grants from the National Institutes of Health received by the University of Hawaii in recent years. It's co-led by the former dean of the John A. Burns School of Medicine, Dr. Jairus Hedges, and myself. And we have assembled an extraordinary team of research scientists doing work in basic biomedical, clinical, and behavioral research. Our overarching goal is to improve the health of our families, our neighbors, our communities, with a focus on those who are most vulnerable and experience health disparities in relationship to health outcomes and healthcare access.
Are there specific populations that Ola Hawaii is focusing on?
You may know that the state of Hawaii ranks first in being a healthy state in terms of life expectancy. And what this means is that people of Hawaii, when compared to people in other states, have the longest lifespan. But you may also know that it doesn't exist for all populations.
Right.
Populations such as Hawaiians, Filipinos, and other Pacific Islanders have persistent health disparities with deadly impact. So the intent of Ola Hawaii is to do research that changes that landscape and improves the health for all.
It's a great mission. It's not always easy to do that. So how do you plan to achieve that?
Our primary goal is building a scientific workforce that does research for Hawaii that is community-based, community-engaged, and culturally relevant, and addresses the health priorities for our state. We do pilot projects and larger research projects that address the concerns that we have: cancer, heart disease, diabetes, COVID, HIV, obesity, and substance abuse.
You did mention COVID, which I want to ask you about, but before we move on, I want to talk about what we have in front of us. We have, kalo, lettuce, rosemary. Why do we have this here?
One of our research projects, co-led by Drs. Jane Changdoa, Office of Public Health Studies, and Ms. Ilimahola Tismosa, a health leader in Waimanalo, is helping families build backyard aquaponics. And so the produce that you have in front of you is from Waimanalo. The intent is to help families with healthy consumption by growing their own produce and raising fish in their own backyards.
And that's great. So it's right there. The access is just right there. And then also it can be expensive if you have to go to the store and all that.
Absolutely.
And sometimes with supply issues, you don't always have it readily available.
Right.
So this is one solution.
Right.
Going back to what you mentioned about COVID, can you talk more about that?
Yes. We have another large research project co-led by Drs. Gihan Devendra and Joan Park of the School of Medicine, and their focus is on long-haul COVID. We have a lot of information on acute infection from COVID-19, but there's growing concern in Hawaii and in the nation on long-haul COVID, which is the persistence of COVID 30 days or even several months after an infection. And symptoms include recurring fatigue, depression, anxiety, muscle aches, and it is estimated to affect at least 30% of those people who have had acute COVID. Wow. The intent of the study is to look at blood biomarkers and pulmonary function as a way to address long-haul COVID and to sort through its resolution.
And anything else you want to mention about Ola Hawaii? They're doing so much for the community, and I like that you kept on using the word community, because it is all about Hawaii and the residents here.
Oh, thank you. You know, Ola Hawaii is just one part of the larger kuleana of the University of Hawaii to do community-based research that addresses and benefits the entire state of Hawaii. So it's developing a workforce to work in Hawaii. It boosts the economy, and I think in our case it absolutely focuses on trying to get everybody healthy in our own island homeland.
And if anyone wants more information about Ola Hawaii, should they go to your website, or is there a number they can call? Or
they can go to our website, which is listed
right there, ola.jabsum.hawaii.edu. Very important mission. And
Thank you.
Congratulations.
Mahalo nui.
Yeah, thank you, doctor.
Thank you.